But the good thing is, since you're here today, it'll be easier for you to get back in and see us in the future. We don't need to make any plans right now. I just need to make sure that we walk through a few things in the computer in preparation, and that's pretty much it. Okay. Any questions so far?
Yeah, can you explain for us what's the chemotherapy and how it works?
Yeah, so if we need chemotherapy, and right now I don't know that we need it.
Hopefully we don't need it.
Hopefully you don't need it, yes. But if you like to plan, and you're a planner, then what you'll want to know is that chemotherapy is given once every 3 weeks. It's a 2-drug combination every 3 weeks. It's very standard. You should not plan to do it in the United States because you don't need to. To me, what you need is the skill of the surgery. I would do that in the US because that requires skill. But there's no skill required for chemotherapy. Anybody can do it. Yeah. And so you can do that at home. I think there's a big advantage to doing chemotherapy at home. You're around family. You get to sleep in your own bed, much more comfortable, okay? If you need chemo.
Yeah, hopefully we don't need it.
Yeah, hopefully you don't need it. You would not start chemotherapy immediately after surgery.
But what does chemotherapy, how does it work on the cancer cells and stuff? Can you explain that?
Yes, so this chemotherapy tries to damage the DNA of the cancer cells.
Okay.
It also tries to prevent them from making copies of themselves.
Okay.
So
no cloning.
No cloning, yeah. It tries to stop that cloning. The problem is your body needs to make more white blood cells, red blood cells, and platelets. Okay, and so the problem is chemotherapy stops that too. Because your white blood cells are trying to make copies of themselves. But those are good cells. And so the chemotherapy will stop that. And so your immune system will go down. Okay. The other thing that it can do is it can damage the nerves in the hands and feet, and so some people will get neuropathy.
Can we opt out of this option if
you can? So
is there an alternative?
No, I mean if the recommendation is chemotherapy, then there's no alternative. You can say no, I'm not doing the chemotherapy, but it would be against the recommendation. But anybody can say no.
Okay.
Yeah. So I mean our philosophy here is to give you the information and help you make a choice. If you choose not to do it, then it doesn't hurt our feelings. It just it wouldn't be the best.
Okay. Nice. Good to know.
Thank you very much.
So let me just walk through some of these questions and make sure I haven't missed something.
Go ahead.
Things you've been diagnosed with in the past. The pituitary gland was big.
Mass adenoma.
Adenoma. That's considered benign.
Benign. Yeah.
Okay. You've had low vitamin D in the past. You've had a goiter. You've had high cholesterol and headaches. And then also depressed mood in the past. Okay. But importantly, no heart disease, lung disease, or diabetes.
No.
Good. And then as far as surgeries in the past, I see the tonsils, I see some endometrial things, but nothing major for surgery, right?
Yeah.
Okay. So part of what I'm trying to decide is whether or not it's safe to give someone like you chemotherapy if you need it. Is it safe? And so far everything is looking good.
All right.
Okay. And as far as family support goes, what is the living situation like at home?
Back home.
Yes. Like who lives with you? I'm trying to understand how much support you have to drive you to the clinic, to help you get around the house, grocery shopping.
Super.
Okay.
Yeah.
So do you have somebody who lives with you in the house?
Yeah, of course. My children.
Okay. How many children?
4 of them. Yeah.
Okay.
And also my husband.
Okay. Good.
Yes.
So, sorry, can I
Yes, go ahead.
ask something? What would cause someone to have like reoccurrence of tumors in the brain and then in her thyroid and then.
Oh, well, the thyroid is the cancer usually won't go to the thyroid, but I think what you're saying is what makes it go to other places.
No, I mean, what are there like reasons that would cause someone to have multiple tumors occurring in their lifetime?
So there is if you have a genetic abnormality. So there are some families that have lots and lots of cancers, and it's because there's a gene that goes from mother to child to grandchild. There's a gene that can do that. I'm not saying you have that. As far as we know, you don't have that. But to answer that question, what causes it? It's a gene that causes it. There is a gene. Yes. The reason is this: every cell inside your body has hundreds of genes that tell the cell when to grow, when to stop growing, and when to die. It says the genes control all that. When cancers develop, there is a gene that tells the cell, don't die. Another gene that tells the cancer cell to grow, make more copies, make more cloning. Okay, and when you do that and you don't die, you get a tumor. It forms a tumor, and the tumors get bigger, and you can make these tumors anywhere in your body. Okay, that's if you have a gene that you received from your parents and your grandparents and your great-great-grandparents. Okay, there are families like that.
Yeah.
I don't think you have that. Okay, so I don't think you have to worry about that, because usually if you have that, you would know, because you would tell me that your sisters, brothers, your parents, they've all got cancer.
So if she doesn't, then what would be?
What would be the cause? Yeah. So what would be the cause here is just a very common cancer. Endometrial cancer in the U.S., I don't know worldwide, but in the U.S. is the most common gynecologic cancer. So gynecologic meaning, women cancer. It's the most common. If you ask in all women, it's going to be breast cancer. But if it's GYN, it's endometrial cancer. It's the most common. So what causes endometrial cancer? Part of it is having too much estrogen in your body over a long period of time. The estrogen tells your endometrium or your uterus to grow and divide, make copies. That's what it does. But normally the cells, when they're growing for a while, they stop and they say, okay, now it's time to die, and they go away. Cancer develops when they grow, but there's no more signal to tell them to die, and then they don't die, and they keep growing. And so why does that happen? Not sure, but
it happens.
It just happens. Yeah.
I think also pollution would have.
I don't know. I wouldn't doubt that. I'm not saying no. It may not be the most common reason. I would say,
Lifestyle, diet.
If you don't exercise. So what we know can protect you, okay, is diet, having a good healthy diet, exercise.
What does the diet consist of?
It's anything that helps you lose weight. So if you are eating a diet that makes you gain weight, it's the weight gain that is associated. Yeah, that's harmful. It makes you more likely to get cancer. So the diet, it's not like you have to avoid spicy foods. It's not that kind of thing. It's the foods that make you gain weight that is the problem. Yeah. Exercise, losing weight.
Yeah, well-being.
Yes. The reason why diet is so important is because estrogen comes from the fat in your body. So the more fat you have in your body, the more estrogen you have. And the estrogen is the hormone that tells your uterus to grow, divide, clone. And so the best thing you can do to reduce the chance of having endometrial cancer is exercise,
Yeah.
healthy diet,
Yeah.
and maintain a low weight.
Right. I think also emotionally.
Mm.
Yeah.
Yeah. There is. I'm not sure exactly what the connection is between the mind and the body, but I know there is a connection. I don't know how much. I don't know how much emotion will increase affect your cancer risk.
I mean, like stress, pressure from here and there.
Yeah, possibly. I don't know how much. I don't know how much.
Yeah, yeah. Thank you, doctor.
Yeah.
Thank you very much.
Okay. So, but to your other question, like to your previous question of what makes cancer come in other parts of the body, cancers like to send out seeds. Okay. The seeds can leave the uterus and they can stick in other parts of your body, but we can't see them.
Mm.
We can't see them, and if you can't see them, you can't cut them out.
Mm-hmm.
So here in the U.S., we have a lot of weeds, dandelions. Dandelions, they look like yellow flowers.
Yeah.
Yeah.
In the springtime, they're everywhere.
Yeah.
Most people try to kill them because you don't want them, because it kills your grass.
All right.
And so if you like to have grass, then the weeds will kill the grass.
All right.
So the problem is, if you see one weed, you can dig it out. You can throw it away.
Mm-hmm.
But you have to be worried that 1 week, 2 weeks, 3 weeks, there's going to be more weeds because the seed is there and you can't see the seed.
All right.
And so what we're trying to decide is whether or not we need to spray the yard with weed killer.
All
Yeah.
right.
Okay? And how do we decide if we need to give you a weed killer? We need to look at the surgical characteristics of the tumor. So for example, is the tumor going all the way through the uterus? That makes me worried. If it knows how to go all the way through the uterus, then I'm going to be worried that little seeds went somewhere else. Okay? Did the cancer go to a lymph node? If it goes to a lymph node, again, I'm going to be worried. It knows how to travel. And if it shows me that it knows how to travel, then I'm going to say you need chemo.
Yeah.
Another example is when you have surgery, they're going to start looking at other parts on the inside. They're going to take pieces of what's called the omentum. The omentum is a part of your body on the inside that you really don't need. You can live without it.
Mm-hmm.
It's like appendix. Have you heard of the appendix?
Yeah, appendix, yeah.
Yeah, you can cut it out.
What is it called, sir?
Omentum.
Omentum.
Yeah. You don't need to live with it.
All right.
Yeah. We remove it all the time, and people are just fine.
Yeah, okay.
Yeah.
Surgically.
Surgically, yeah.
All right.
The omentum is it's like it's a sheet of fat that everybody has. It lays right on top of the intestines.
Mm-hmm.
And it separates the intestines from the abdominal wall. So if your muscles are abdominal muscles are here, the intestines are here, the omentum goes right in between.
All right. Okay.
Yeah. So the surgeons will look at that, and if there's cancer in the omentum, then we need to talk about chemo. So that shows me that the cancer knows how to escape. If the cancer knows how to escape, or if we believe that we're worried about it escaping, then we're going to talk about chemo.
Okay.
Yeah.
And this is after the surgery.
After the surgery.
And checking out the
Adrenals.
what do you mean?
Maybe not the adrenals, but the lymph nodes.
The lymph nodes.
Lymph
Yeah,
node,
the lymph nodes,
yeah.
yeah.
And this is, you check it outside my body, not.
Oh yes, they're
Yeah.
going to remove it from your body.
All right.
And
Okay.
yes, and you'll never get it back.
All right.
They're going to take it. You're never going to get it back. But it's okay. You don't need them. You have thousands of lymph nodes in your body.
Wow.
Okay.
Yeah.
The lymph nodes are they're good. They're good things. They like to trap infection,
Infection.
and they like to kill infection.
Yeah.
But they also like to trap cancer, but they can't kill cancer.
All right.
They just trap them. And so what the surgeons will do is when they look inside, if they find any lymph node that is big, they're going to take it out. If it looks normal, they'll probably leave it alone. But if it
Yeah.
looks big, they'll take it out.
Are there any things that may enlarge a lymph node other than cancer?
Yep, a lot of things. Infection,
Infection,
Yeah.
Yeah.
that's the big one.
Yeah.
Okay.
That's it.
But at this point, we don't have enough information.
Yeah.
Yeah.
So,
We
but
just
it's good. It's good to ask questions
Yeah.
now
Yeah.
so that you know
Yeah.
what to expect.
Exactly.
Yeah. Thank you. God bless you, doctor.
Other things, just to make sure you're aware of, what will normally happen is you go for the surgery. The surgeons will tell you the diagnosis while you're in the hospital, while you're recovering from surgery.
Sorry, again,
Mhm.
I kind of zoned out.
Yeah.
Can you say that?
Yeah, I'm just going over what is the next step.
Yes.
Okay, so the next step is you go for surgery. Okay, and then when you're in the hospital and you're recovering from the surgery, the surgeons will usually tell you the diagnosis. They'll tell you what happened to the lymph nodes, what happened to the omentum, what happened to everything. They'll talk to you about it.
Okay.
And they will also tell you what it means. Does it mean you need radiation? Does it mean you need chemo? They will tell you what they think, but in the end, the final decision about chemo and radiation will not be made in the hospital. The chemotherapy decision will be made by us in the chemo. We're the chemotherapy team, and then the radiation team will also make the final decision on radiation. But at least in the hospital, they can tell you what they think is going to happen.
Okay.
Because they have a lot of experience with this, so they'll tell you what they think.
Okay.
All right.
And so let me just see, your appointment for surgery is the 15th.
15th, yeah.
Okay. So what we should do, and that's a Monday,
Yeah.
what we should do is try to see you back here maybe one week or 2 weeks after surgery. But let me ask you this, how long were you planning to stay in the US after surgery?
It depends on the recovery, the doctors.
Okay,
They
as long as
say.
you need to, basically.
Yeah.
You can stay as long as necessary.
Yeah.
Okay.
Yeah.
So then what I would say is probably the week of April 22nd, anytime that week, or April 29th. The reason why I say 1 or 2 weeks after surgery, the normal time to begin chemo, if you're going to do chemo, the normal time to do it is 3 or 4 weeks after surgery.
Yeah.
So if we see you 1 or 2 weeks after surgery, that should be good. Then that would give you time to go home, make an appointment to do all of that at home. Or you decide if you want to stay here for all of that. If you can stay here for all of that and you don't mind staying here, you can. But it's not my favorite thing to do because you're far away from family, and they're going to be a major support for you. And being here is going to be, I think, mentally harder for you to be here taking chemotherapy.
Yeah.
What's the consequences of these chemotherapy?
Sorry.
Yeah. You are saying, doctor, that I should be with the family, and I need the support. Why?
Because sometimes people will be nauseated and you might throw up. Okay. In that case, it might be nice if someone were there to just put an arm around you and reassure you that, okay, we're here to help you, we're here to support you. So mentally, it's better for you to be there. If you're here, you only have your 2 people here.
Yeah.
So there's not as many people here to help you.
Yeah.
And then also sleeping in a bed. I mean, most people don't like sleeping in a hotel. It's not as comfortable. You don't sleep as well. You're sleeping in your own bed is always just more comfortable.
All right. Okay.
And then food, I think, is huge.
Yeah.
So if you're here, you're probably going to eat a lot of American food, right? I get it. So yeah, you can have people cook for you, but it won't be the same. The spices won't be the same. The ingredients won't be the same.
Yeah.
You can probably find a lot of it here, but it won't be. And so again, when we need you to eat and be physically strong and have a good appetite, you're stuck eating American food, you probably are not going to have a good appetite. Okay, so again, being home makes everything better.
Yeah, makes more sense.
Yeah.
Thank you, doctor.
Yeah.
Thank you.
Thank you, doctor.
Okay, so, but at any rate, we should meet with you after surgery, so that we can make a plan.
If needed.
Yeah, if needed, yeah. So we can tell you, we hopefully we say no need for chemotherapy, everything looks good, you're done.
You're gonna manifest that.
Yeah. And then, you know, if the radiation doctor tells you you need radiation, I don't know. I guess I don't know if you can do that back at home.
So what's the difference between the two?
So radiation uses, okay, so chemotherapy goes in your veins. It's a drug that goes in your veins. It goes everywhere your blood goes. Okay, so it goes everywhere in your body. And that's the reason why you have potentially side effects all over your body, which is like nerve injury and also red cells, white cells, and platelets. Okay, radiation is different. Radiation is like, if you think of like a sunburn, okay, so you can only get a sunburn on the part of your skin where the sun hits it. Right? You can't get a sunburn on your chest if you're wearing clothes, but on your hands, yes. Okay, so radiation is similar. It's very targeted. They point that beam at your pelvis. Your skin will be fine. You usually don't get a lot of trouble with your skin, but on the inside, the inside of your pelvis, that's where the burning happens. There's not a lot of pain, so I don't want you to think it's the same as having a sunburn on the inside of your body. The reason why I use the analogy of a sunburn is that it's very focused. It doesn't happen everywhere, only where they point the beam. Okay. The reason why they point the beam is because if you have cancer in the uterus, there's sometimes little seeds come very close to the cancer. You remove the uterus, but the seeds are left behind in that one spot. If we suspect that, if we think that happened, then the radiation oncologist will point the beam at the spot where the cancer used to be, where the cancer was, even though it's not there anymore, and they will point the beam there to try to kill any seeds that are left behind. They'll try to. But that, so for the radiation, it requires a lot of math, a lot of calculations, and it usually requires a lot of experience. And so that's even in the U.S., there are small cities in the U.S. that cannot do this type of radiation, and so they come to the big places like Mayo, like University of Minnesota. Big hospitals can do the radiation. So I don't want to assume that if you go home that they can do this type of radiation. The only way to know would be to ask your oncology doctors at home. You can tell them, look, Mayo recommends I have this type of radiation. Read the note. You can show them our note from radiation and Mayo and ask them, can they do this type of radiation? If they say yes, no problem, then good. You're good to go. If they say no, this is too complicated, stay at Mayo, then you stay at Mayo for the radiation.
What is I think chemo more harsh than.
You're right. So so to give you an idea, radiation is only about 1.5 months. So if the maximum radiation is going to be about 1.5 months maximum. Chemotherapy is going to be about 4.5 months. So chemotherapy is longer. And you're right, it goes everywhere in the body, so it affects the whole body. Radiation is shorter and only in one spot. Radiation, I hope that radiation is only 3 days. That's the shortest it can be, 3 days.
And what determines whether you need this or that?
It depends. For example, did the cancer go through the uterus? Did it get into the lymph nodes? These are the things that we're going to be looking for when we decide how much radiation and how much chemotherapy. So right now, everything depends on the surgery. So even the radiation doctors won't know what to do yet.
Yeah. Okay.
Yeah. When do you meet with them? Did you already meet with them?
No. I don't think that we have
No, they didn't set the date.
schedule
Okay.
for
Yeah.
that.
I think that's fine. You can meet with them after when we have more information, because
exactly.
they're going to do the same thing I'm doing.
All right.
They're going to say, I'm not sure if you need it. Maybe yes, maybe no.
Oh, okay. Yeah. Yeah. Okay.
Wait till after is okay.
Clear.
Okay.
All right. Let me see. I looked at your CT scan already. This was the one from several days ago.
Yeah.
Yes. Okay. The only thing we saw, the main thing we saw was really just the abdomen and pelvis.
Mm-hmm.
Okay. And then you haven't had a chest CT yet, have you?
No.
Do I have?
I don't see one.
Yeah.
Do we need one?
I think it would be helpful to make sure that the chest is clean and that there's nothing in there. It doesn't have to happen before surgery. It could happen even after surgery, but if you're here in the U.S. and we're just waiting until April 15th, we can do it Are you going to stay here until the 15th, or are you going back home and then?
No,
you're
we're staying.
there?
Yeah.
Okay.
Yeah.
Okay. So I think we can do a chest CT anytime. I mean, the reason why I'm not pushing for it very hard is because I don't know if we even need it. The normal place for cancer to go is first in the abdomen and pelvis. That's usually where it goes first. And so right now on this CT scan, we don't see it anywhere else.
Mm.
So what are the chances that it went to the chest? Probably
0.
Almost.
Negligible.
Not quite 0, but almost. So I think I don't want to put you through a test that's unnecessary.
Yeah.
So I mean, I think we can wait.
Yeah.
Even though you don't have it, let's see what the surgery shows. If the surgery shows us the cancer has spread to multiple areas, then I want to see a chest CT.
Okay.
No.
Okay. I think that's it.
Yeah. Okay.
I think the main thing you can do while you're here is to try to be physically active, to build your muscles, because after surgery you're going to spend a lot of time lying down in a hospital bed. Okay, so your muscles are going to get weaker.
Yeah.
So it would be better if you had strong muscles to begin with, so that you can come down.
Yeah.
If you're already down here, you don't have much room to come
Yeah.
down. So we want you up here so you can come down a little bit and you're still strong. So while you're here, have you gone to the mall yet?
Yeah, we went to the Barnes and Nobles.
Barnes and Noble's good. Yeah. So that's nice, because these days, okay, it's still cold, even though it's supposed to be spring here pretty soon. It's still cold, so a lot of patients like to go to the Barnes and Noble at the mall and just walk around.
All right.
And just keep on walking.
Okay.
That way you're inside.
Okay.
And I would encourage you to do that. Otherwise, there's not much else to do. You can walk. If you like to go outdoors, you can walk. There's a lot of trails. If you just go on Google, you can see a lot of walking trails. Minnesota people like to ride their bike and walk on the trails outside. So you can
Do you need
definitely
any
do that.
weightlifting?
You don't necessarily need weightlifting. Do you normally do weight training?
No.
Yeah,
No.
before, a long
Before
time
a
ago.
time ago,
After
okay.
I became so lazy.
I don't think you need to. I think the main, even if you're just walking,
Yeah.
I think that would be good.
Okay.
Yeah.
Okay.
Because you use a lot of muscles just walking.
Okay. What about here, Mayo? They don't offer like a gym for the.
Only for employees.
All right.
So the gym that is very popular in Rochester is the RAC, R-A-C, Rochester Athletic Club. All the doctors. So even though doctors have a gym at Mayo, and we can go to the gym at Mayo for very cheap. A lot of doctors choose not to go to the Mayo gym because the RAC is nicer.
All right.
And yeah, we have to pay, but it's nicer, so then we go there instead of going here.
Yeah.
So they have, for example, swimming pools, tennis courts, basketball courts, weightlifting, and walking.
And
Lots
track,
of walking
yeah,
track.
okay,
Yeah.
yeah.
So everything you need. Do you have small children here with you? No small children. Okay. They have another area for small children,
All right.
so that the parents could just drop them there and then
Yeah,
go
yeah.
go exercise.
Which is good, yeah.
Yeah. So it's very, very family friendly.
All right.
Mhm.
Maybe, yeah.
Yeah, I think if you're going to be in town and you want to do something physical and be
Yes,
indoors,
I want, yeah.
I think the rack is good.
Okay.
You can buy a membership there. You have to buy a membership
Yeah, yeah,
to go there.
yeah.
Mhm.
I will, inshallah.
Okay, nice. Good to know.
Yeah. Thank you, doctor.
Yeah, you're welcome.
Thank you for the advice and
Yeah,
thank you
you're
for giving the information so
That's
that
why we're here.
Yeah, thank you very much. God bless you.
So so what we'll do is I'll put an order to bring you back after surgery, and hopefully it's a really quick visit to say no chemo.
Yes.
And I mean, the other thing too is like your surgery team might already say no chemo, and if they say no chemo, then they could just cancel the appointment.
All right.
Okay.
But so just talk to them.
All
Okay.
right.
They'll know.
Yeah.
All right. I think that's it.
All right.
Okay,
Thank you.
thank
Anything
you.
else?
No.
Pleasure to meet you.
Yes,
Thank
nice
you
to
very
meet you
much
as well.
and
Yeah.
have a very wonderful day. Thank you, doctor.
I'll walk out with you here, and
Yeah.
I'll drop off one of these pieces of paper.
Okay, yes, doctor.